let's start finally in a place that is very quiet. And I think this conversation comes very much in time because you might not know this, but we spent the last 38 minutes trying to figure out a way of doing this and having some technical issues. So, of course, continuous improvement comes as a key topic for us. So how can we do better next time? So I have with me, thank you so much, Oliver. Oliver, that is a specialist in continuous improvement. I brought him on the program because I think in healthcare, I face so many challenges and I see so many ways to improve things, but sometimes we don't necessarily know how to do it, what methodologies are available, how can we start from small little steps. So thank you so much for coming here.
So for the start, let me bounce back the question to you. What do you see is a big difficulty or a common problem in your daily work today when you are a nurse?
For me, I'm very much about innovation. So I hate seeing things that are not working and continuously not working, where you spend amounts of time and nobody really does anything to improve that. So for me, for example, one of the things that we've been talking today in a session that I was in, the flow of patients in hospitals, it's very inadequate. Sometimes they push us patients, they don't speak with us, be careful about our breaks. Sometimes patients are frustrated because they want to go home, but they're still waiting for, medication or this or that. So sometimes there's a lot of inconsistency in terms of communication, but also of patient flow. And so I think, this is a problem over and over and again, and there's so much technology available. And I'm wondering why, we haven't adopted or tried to improve, even with small steps, right? Because not everything has to be with technology to try and improve this flow and optimization of our work as well. So this is one of my frustrations. And that's one of the reasons why I got into continuous improvement and service improvement. And I then have a project within the trust that I work in. So I've always been interested in this topic. And that's why when you said that you worked in continuous improvement, we met by context, we met in the YouTube Part-Times Academy. I thought I need to speak with him and learn a little bit more about somebody that is specialized in continuous improvement and works in the government sector, to see what challenges does he face and if he has any other alternatives and tips for us as clinicians to improve services.
And I'm already somehow demonstrating that how this works. So when I start to work with a new client, I immediately start asking, what's the problem for you? What's the issue? So instead of talking about concepts and methodologies, I try to understand what's broken and help them to fix that issue. And once we solve a few topics, then we can come back and talk about the methodology and talk about training and how we go forward in a more fancy. So if you talk about that there's a difficulty with patient flow, then I would start with asking more questions. So when do people arrive to the hospital? Who is the first contact point? What is the purpose of their visit? Have they been contacted before? Do they know where to go in the hospital? How much time they spend? And when they leave, who helps them to leave? And what is the decision or how it is organized when they leave the hospital? And you were talking about technology. Technology can help, but technology is a neutral thing. So if something is not well organized, if you deploy new technology on it, you will have something that is not well organized, but super fancy with technology. So usually what I recommend is either look at the things and check that can we improve it, and then deploy the technology and use new ways of working on top of it, digital workflows, or we do the two together at the same time, that we use the possibility that, finally management and the organization agreed to deploy a new technology, then we use this to also resting. So a lot of the work would be talking to the patients, talking to the nurses, talking to the doctors, and understand what is happening before we take a lot of action and a lot of training. But this is my ways of working.
Okay.
Me, I like to focus on outcome and results immediately and to generate motivation and buy-in. And I only teach and only reveal the necessary about the methodology and what we are doing. If the team is not really interested, then I only do a basic amount.
Okay.
If they are really into it and they want to know how it works, then we do a little bit.
Okay, interesting. Okay. So you're saying first you need to understand how the system works, talk with people, understand the process, understand if there is a good operational kind of management, because if you understand very well, it means that things are working. somehow, can't find how it works properly, or there's a lot of blurry areas, then perhaps that's where continuous improvement might be applied as well. And so in terms of like, how come did you came into continuous improvement? Like how, what's your background? And I know that you now work in the government. Can you give a little bit more context to our audience, and how did you end up in continuous improvement and where you are now?
So this was not something that I planned. And when I started my career, I studied bio engineering, chemical engineering at the university. And those times, there was one professor who was always asking feedback. That was the course good? How did you like the material? Did you understand what I was talking about? And I found this really appealing. And I joined his department and his team for my diploma thesis work. And it was about Six Sigma. That was the first years when these methodologies started to be really popular also in education. And then somehow it stayed with me. And in all my jobs, somehow these roles and found me. And about 10 years ago, I decided, okay, I like this so much, close to what I like to do, that I decided that this would profile my main profession. And in terms of government, this was by accident. Someone encouraged me to apply for a job here in Brussels. And the manager who have seen my CV actually said that not for the one that I applied for, but he would be interested if I would come and join his team to improve the workflows in another role. And then that was 20 years ago, and now I'm here in Brussels, and I think this is the ninth year.
That's fantastic. But I know that you didn't start in government, right? Where did you start? And, what types of work did you do? And how is different with the work that you have today?
So at the beginning, I was more like in the junior learning role, leading small projects. I worked in a laboratory for analysis of foodstuff and environment. I've worked in food manufacturing, where cost saving, efficiency improvement is always a big topic. And afterwards, I switched, and instead of being a part-time improvement person, I started to teach and help others to deploy these systems. And today, that's my main identity, that I help people with the continuous improvement. I mentor younger people who would like to develop into this profession. I help the people with training and in general propagate this.
Okay, that's fantastic. So we're going to talk about healthcare, right? Continuous improvement in healthcare. And so let's start by asking one question. I know that there's a lot of methodologies out there that you could apply to the continuous improvement, right? And we already kind of said, if I was just starting out, it's very difficult to know and, learn all the methodologies because it takes time. You need to apply them well. And I know that a lot of methodologies were kind of made by the industries rather than the healthcare. So I was just wondering, do you think that we can still apply those methodologies, like, for example, you mentioned Six Sigma, into healthcare? And is there any difference between the way we applied them?
So this is a question that I get all the time, because now in government, this is not something that is very widely used. It's more like I find here or there a pioneer who is familiar with these ways of working. So it's more like that in manufacturing, they have been doing this for decades. Like in one of my jobs, I had to find cost saving on a production line that have been optimized every year, 2-3 times in the past decade. The tools and the sophistication that was required were really high level to find still improvements and still find cost saving. The main difference I see that if I do this in now here in Brussels, in the EU government context, or if you would do this in healthcare, it's actually not that it is manufacturing or services or healthcare or government, but the fact that you haven't done this before. So if you are starting out, your problems and issues are very different from an organization that has been doing this for decades. And of course, there are differences also if you move physical products, or you have people who are moving around in a building, or you have something that is completely digital, or it's pure information. Like in a typical central government organization, all the workflows are somewhere behind the screen. Yeah, it's informatical systems that move around. While if you are in a hospital, you have people moving around and you have physical goods. While if you're making food or if you're producing cars, most of the things are physical raw materials, machinery that are. And of course, there are characteristics that are different, but the main principles are similar. So if you would start in a hospital, issues that you face were like, procedures? Are they written down? Do people know what we need to do? Do you have a process map that tells what's happening in the workflow? Do you have indicators that tell that how much you would need to do from something? Do you have thresholds that tells that if you do this and it's below or over, is it good or bad? This is a different problematic than in a factory when they have been doing this for many, many years, and these questions are not even asked out because it's like a trivial that they have.
Okay, very, very interesting. So in that case, because we know that you can still apply them, but the types of the industry is very different. The core goal is very different, right? In industries, more optimize money and resources and much more profit making. In healthcare is about obviously manage well money, but that sometimes is not the case, as we know. And I've seen very much a lot of inefficiency in a way that they could improve costs and they don't do it. But then there is a human aspect of it. Because in factories, it's a line of production, right? In healthcare, it's human people, right? Is there any specific way that you would say to people to pay attention in the way that the methodologies are designed, or in the way that we make the continuous improvement, to take in consideration the people's aspect of continuous improvement that maybe the methodologies don't cover as much?
This is also a common question that I hear at the beginning, especially here in government, and it would be the same in health facility, that we are working with people. You don't want to lose this touch, and actually this is the primary goal of the organization. And if you use any of these methodologies, Lean or Lean Six Sigma that I am using, always what we teach is that who comes first is the customer. So actually we would teach you even more or help you to get tools and to do it in a proper way, what you already want to do. And how you use it in the organization and what's your primary goal, that's another question. So if your goal is cost saving, and then if you optimize the workflow and then people are freed up from work, and instead of deploying them to other functions and increase the services, you use this for cost saving, or for example, instead of spending more time with patients, you reduce the time and then you understand less, or you lose this human edge. It's not because of the methodology, it's because of the management decision that what's in focus. So what we encourage is to understand what's the goal. So if, for example, you want to spend more time with patients, then actually this can help to free up your time from administrative work or non-value added work, that you can spend more time with the patients.
Exactly. So it's about how do you apply those skill sets and try to optimize the way you work.
Because the methodology itself is neutral, and which way you use it is really depending on the organization. What is difficult that if it has been used once and not in the right way, and it has been in a way to take away the human touch, then it's difficult to do it again, because then we have to repair the damage that has been done before, and get buy-in and get people again motivated and have them to do it in a good way.
Very interesting. The application, the right application of the tools, I think it's extremely important, as you said. The other question that I have, so we've seen that like the private sector kind of tries to optimize as much as they can, and they really invest a lot in continuous improvement, or at least that's what I've been hearing, because my experience in the private sector is very limited. But in the public sector, there seems to be a less or a carefulness way of actually continuously improve to try and optimize resources and optimize other streams. Why do you think is that?
There can be many reasons. So I wouldn't say there's no wish to improve things, but the priorities are different. So the focus in the for-profit sector is profit. So if your profit margin goes down, you have to do something. So these methodologies used a lot in this sense, that how we can generate more income, more profit. And actually the customer comes second. So in order to have more profit, we serve the customer better, who in exchange will pay more, buy more services, and so on. While in the government sector and also in the healthcare sector, comes first is the patient. It's not like we want profiting, then in order for this we want to help people. It's like it comes first. However, these ways of working, of always improving, looking for efficiency in certain professions already present if you study at the university. And for me, as an engineering, this was always part of the study.
Okay.
In other
Okay.
professions, emphasis on or something else. Government, many people come from a legal background, and if you study law, the main emphasis is not on efficiency, it's more on that what's right or wrong, what are the main values in society that we have to respect. So for example, in a trial, if you have a legal case, the main emphasis is to get it right and be sure that the decision in the end is legally correct, and the judge really decides right or wrong in a proper way, and not on how long it takes. While in a manufacturing setting, usually we have something that is good enough. If the customer is happy, then we stop at that level of quality, but we want to do as much as possible. So the emphasis is somewhere else. But if you have too much work in government and you want to reduce workload, these tools and these concepts are very handy to start with.
I think you made a very important point. I think, yes, looking back, for example, in my university, I never studied continuous improvement. So maybe that's why that's why I like to work with engineers, because they are always finding a way of doing things better. And that's maybe why, I was very interested to hear your perspective. So in that case, let's say, we have all these healthcare professionals that are being frustrated. You've seen on the news, healthcare professionals have been fed up. They're trying to find ways of staying in their professions because a lot of people are leaving. A lot of people are trying to stay, but with a lot of difficulties. And if they want to improve processes within the healthcare sector and they are clinicians, how do you think they should approach this? Like, what is the first step and what should be the next step? For people, if you give me an example initially of a person that doesn't have any experience whatsoever and a person that has some elements of and methodologies of continuous improvement, what would be the differences in approaches?
So if we start with someone who has no experience, I will start to understand what's important and what's the motivation behind to delve into this subject. And I would focus always on the primary goal and motivation, either of the organization or the individual. And then this would be just like a supporting methodology in the background to help them to get there. If someone has already experience in this, then we could switch to a different approach where we would rather focus on understanding that, okay, you have been doing this for a couple of years. Are you happy with your advancement? Do you want to do more? Which are the areas that need improvement in terms of improvement? And then we would look for this specific. So with someone who is starting out, we would spend a lot of time around this. The customer needs, how are the patients feeling? What are their main issues? If you want to serve better the patients, what are the current problems that gets in the way? What do you think is a value-added activity for the patients? And if I talk to clinicians, medical professionals, what they tell me that value-added is to understand what's the problem of the patient, what is the diagnosis, what is the sickness, consultation with other doctors to understand what's behind a difficult case, talking to the patients, understanding their history, what was happening before. Then the actual treatment, the operation, the treatment, the first aid, and so on. What is usually not considered a value-added activity is walking between rooms, going to fetch supplies, cleaning, administrative work. If someone made a mistake, then correcting that mistake. I don't know, someone is not at the right department and they have to move to another one and to find the right person there. And so on. These are not value-added activities, but often these take up the majority of the time.
Okay.
You have little time on actually working.
Okay, interesting. And now in terms of who leads continuous improvement? Because in healthcare, there's a lot of this thing that you have the managers, right? At least here in the UK. And then the managers tend to focus on the daily operation of running of the business, right? Or the business, in this case, healthcare. But then is the manager the right person to do this? Or do you think that actually we should have maybe another type of manager, which is a manager for improvement that obviously has maybe perhaps different leadership type of managing, because you're managing change, you're not managing operations? Or do you think the same person could do both works?
It depends, I would say, in three factors. One, that
Okay.
are you at the beginning or at the end of the journey?
Uh-huh.
It depends on the ambition of how much you want to do of this. And third,
Mhm.
depends also on the culture of the organization. So when
Okay.
starting out, I wouldn't focus too much on these roles. I would rather focus on how to have results. And once we have results, we have also a little bit of understanding experience at how this organization works. And then we can
Okay.
design and adapt. Then if the ambition is just to keep it low and do the minimum necessary, then of course it's more like part of the everyday job, and maybe you can have someone in the organization, depending on the size, who does it as part-time, and you can rely on an external person coming in and out, helping you on this journey. And if you have an ambition to really elevate continuous improvement as one of the top values of the organization, usually there are like 3 to 5 values in an organization that you identify these are the main values, then it can be even a department in the organization who maintains this culture, who deploys, who trains people, and who makes sure that it runs. And about the style and the structure, the culture of the organization. So if it is a hierarchical organization, then of course top management support is critical, because people always look at the top,
Yeah.
see that is this important, should it be part of my work or no. If it is a more flattened, participatory organization, then management support is less important, because people decide, the people in the little circles or in the squads, or depending on how you call these teams, those are the ones who need to be interested and motivated. But then still, even in a flat or in a hierarchical structure, you can have someone who does this partly or as a full-time job. Myself, in one of the organizations when I was working, I was part of a team of 50 people all over Europe, and our department was optimizing processes, doing cost saving everywhere in the company. We were going to different factories, and we were teaching this to people, and we were optimizing everything. In another organization, it was more like an external consultant coming in and helping people to learn how to do it. And then when they left, the people were doing a small scale continuous improvement that was required for a job, but that was nobody doing it as good. So you have different models, but I would suggest that at the beginning, if you start small, see if this is something that is interesting, you want to put in more energy, instead of launching a big program with a lot of effort and a lot of resources, a lot of expectations and promises, and then hoping that you deliver those. So rather start small, generate results, and if it is good, then we can scale it up and go forward.
They always say start with pilots, right? You start a project or...
An approach that we always do is before deploying a change, we like to use the pilot approach, because for understanding why and why things are happening the way they are happening in the organization is usually limited. So we want to see that actually our theory of intervention is good. So first we do a pilot. We see if it's working, and if it's working, then we deploy it as well. I usually discourage people to do a massive change without testing it first.
So pilot, and then who manage change depends on the organization, the culture of the organization, and the objectives.
Yes, in most government organizations and healthcare organizations, because you have a classical hierarchical structure with different layers of management, usually what I experience is that if a manager is behind an improvement, is behind a change initiative, then the team or the department belonging to that manager has a good background to go forward. Outside of the department, it would be difficult, or both, because those people have less. So in that sense, management support is very important. And of course, if you have a manager who is really enthusiastic about it, that would come across in the organization. But for management, it's more important to understand mainly the concept, the culture, the main ways of working. The technical knowledge is more for the people who actually do the improvement.
Fantastic. I get it now. I get it. So the last question that I want to ask you before we sum up is basically around data. So we know that nowadays Everybody talks about big data, data science, AI, all the concepts that you can imagine. And I know that Six Sigma uses a lot of data, right? And a lot of continuous improvements. You will need KPIs or ways of measuring, right? So how do you think these new changes with technology will enable continuous improvement to be more efficient? How do you see it changing, especially if you have opinions in terms of the healthcare and the changes that will come with as much data as we are getting, and the challenges as well?
Yeah, so one thing that I always teach people, that if we want to really see the change, we need to measure it, we need to track it, because we forget how it was at the beginning. And if people say to me that, yeah, the stress is high, or we need a big cost saving, I always ask back, so actually, give me a percentage. Give me
Okay.
And then immediately in the team, people say, oh, yeah, but actually that is not big. Or the other one says, no, that is huge. Yeah. What did you think?
Yeah.
When you have numbers behind, immediately you can see if it is right or wrong, or how much we need, and we can organize. If the organization has a culture of collecting data and you have all these databases, then the work is more around getting this data and seeing that what is valuable, what is that we want to track. Maybe you already have the KPIs, these key performance indicators that you want to track, so we can move to different aspects. If you haven't done this before, then it's usually a longer period at the beginning that is spent just around data collection and measurement. I had projects where there was no data collected before, and actually 70-80% of the improvement effort was spent on just finding out that how we can measure things, what is that we want to measure, and then
70%.
yes.
Wow. Okay.
Yeah, for motivation, it needs to be carefully balanced, because if you spend all this time with data collection, the rest of the organization is wondering, so when the improvement will come. So in these situations, what I like to do is to have two streams in parallel. One, when we do small, quick improvements that are more tangible, maybe they are not the most important ones or not about the core workflow, but they bring momentum and you see that there is improvement. And in parallel, we work on the important stuff that takes time and more energy. And once you have this basis to have the data, then you can really unlock big potential for improvement. Then you can have a really good understanding what's happening, where you need to intervene, and then the efforts that you have to spend to improve are usually much, much less. You remove this trial and error aspect, and you are much more intentional in your change.
I think hopefully with the data science and AI, you said 70%, which I thought I never expected was such a high time spent on data collection. But actually, maybe data science and AI will help us really to reduce time spent and reduce the amount of time that we spend maybe collecting data, or at least analyzing data.
We still have time for that. I was working in a recruitment process where we wanted to reduce the time that it takes to people, is quality people that are hired in terms of better skills, better people for the organization. But at the
Yes.
we have very little understanding that how long it takes, which are the departments who are involved, who does what, and just to see that what's happening. Spend a lot of time on mapping the process and really discover that who is doing what and which are the departments involved. And when people have seen the first time the workflow on paper or in a digital format in front of them, they were surprised that there are so many people in so many aspects. And another big project was actually to create a dashboard where management could see that who are the people who are interviewed, who are the people who are running these processes, how many people have been applying, how many people interviews, how many go to the stage after the interview for the real selection process and decision, how many people start on the job, how long these different stages take. And to create this dashboard, it was really a big project where you could see really that the figures, you could see the different departments. Afterwards, when we had the data, it was almost immediately trivial that where we would need to intervene. Yeah, our process step took a long time, and we could really see it on the chart in a graphical way. It was immediately obvious. Yeah, okay. Here is where we have to improve things. While before, it was in the head of the people. Some people had an opinion. Maybe it's slow, maybe it's long. We didn't know, so we couldn't really be intentional. So this is why. But once this dashboard is done, then it's done, and then you can move on and work on other parts. So it's a lot of energy at the beginning if it hasn't been done before.
Yes, but that energy at the beginning actually can have a potential effect on the optimization in the way we work, right? And make it much more enjoyable. So thank you very much. Really appreciated your interview. Is there any last few things that you want to leave with our listeners that might be healthcare professionals, that might be managers in hospitals? Is there any advice or anything that you would like to leave?
Yes, don't wait for others to give you permission to take action. Look into your own job, in your own role, that what is your own responsibility. What is that? Is there something small that you can improve? In French, they often call these petit cailloux, these little stones that you have in the shoe that is bugging you every day, and you always think, okay, now I would need to need to improve this one.
Mhm.
What are 3, 4, 5 things that in your daily job that actually you don't need to ask for permission for this, because it's really
Yes.
your own decision and your authority, and improve 2, 3 of those. If you want to make a little bit better, then advice evangelist is to make a brainstorming, sit down with a colleague, make a list of
Mhm.
10 to 30 topics that need improvement, and agree on 2 or 3 that you say, okay, these 2 or 3 we will fix. And then, then afterwards, if you see the results, then you can go on and do it in a more methodological.
Okay, so it seems like, you don't need a lot of knowledge to start. Don't think about others. The others will join you as they go along. And then work around the organizational culture to try and bring that change. And if you have access to data and you can tell a story through data, is even better. So you have measurable insights. So you have the proof in a way and you can see the changes coming. So thank you so much. It was a pleasure. And thank you really, I learned a lot with you, and it's always a pleasure to speak with you as well. So I'll see you in the next session.
Yes. Thank you, Sidalia, Nurse C. It was great. Bye bye.
Okay. Bye bye.